Let's talk about PTSD. PTSD occurs when people witness a terrible event. My treatment model views this as a situation where when you experience these horrible visual, emotional kinds of stimuli, that your connective tissues that are glued on the inside of your skull and surrounding your brain, that these tissues slightly tighten and shift the skull shape. And when they do that, on top of our history of other injuries that we all have experienced as well, the skull alignment changes so the bones press on the brain in a different fashion than normal, and then because the brain runs hydraulically, then the brain's pattern of behaviors change. So there's 6 different criteria that people suffer from in order to gain the PTSD diagnosis. But they're all these sorts of responses. Statistically, it's been shown to not be effective to counsel people or to have them in group therapy. Not saying that those are not helpful therapies for them overall, but it hasn't statistically been shown to reduce the PTSD symptoms. So with the insomnia, the anxiety, the impression that with just slight changes that they could die, the insomnia, the headache pain, these kinds of situations don't respond to counseling. The one therapy that has been shown to be helpful a majority of the time, like 77% of the time, is EMDR, eye movement desensitization and reprocessing technique. But few of the soldiers that had PTSD were willing to go through with this EMDR process because of how it's set up. Now, I've been through EMDR not because I had PTSD, but because I was curious. And different traumatizing events in my life, I was told to think a lot about them and try to, as much as possible, put myself back in that original state of experiencing that original trauma. So reliving being shamed or being upset or witnessing something that wasn't pleasant, try to go back as much as possible to relive that experience, and while reliving that experience, move the eyes. Well, when you move the eyes, those muscles go all the way through your head to the back of your head, around your skull, and in your eye area, and it changes the meningeal tension patterns because the eye muscles are attached right to the back of the eyes. When we start seeing those kinds of changes, then we can get subtle changes in the shape of the brain. So when people are willing to relive their trauma event, and because they trust the therapist, and then they also do the eye movement while they're reliving the experience, they can get changes for up to 3 or 4 years. Other therapies and drugs haven't been shown to be helpful in even changing the PTSD experience. But with NCR, we do have results with PTSD. In 2010, I worked with the Wounded Warrior Battalion from Camp Pendleton, Oceanside, California, and I treated 6 Afghan war veterans who were survivors of mild traumatic brain injuries and had PTSD. And I was initially planning to treat them 6 4-day treatment series each, because I was quite convinced after 6 series that they would be pretty normal. So I began treating them, and after four-day series, so after each of the soldiers had had 16 treatments, they met after their treatment day and voted to discontinue treatment. And then they alerted me to that, and I was quite alarmed. I was going, the treatments are working well, why would you want to quit? Well, it turned out that they wanted to quit because they were feeling so normal and so much like they had felt back when they were, before they were members of the Marines. They were feeling so much better that they wanted me to start treating others. So then their commanders ended the program and were shocked that we had 100% results, because even the EMDR is 77% effective, but only about 5% of the soldiers involved with those studies were willing to do the whole EMDR process. So even though EMDR was being quite successful, it was actually a very small number of soldiers that were being helped. So when I came in with 100% success with my initial study group, I thought it should be easy to come up with the money to continue this, but the money was not forthcoming, and it still hasn't been there, and that was 5 years ago. How did the NCR help? The same way that we help all these other kinds of conditions that we work with. What we start doing is restoring the original skull alignment. And when we restore the original skull alignment, then we restore the original brain functions. So when these, in this case they were all men, with these men who had seen their what would we call them? Well, they were riding together in their trucks, and then the trucks exploded. So they looked over and saw these people disintegrating. So it was a horrible visual. And that, combined with their concussions from the explosion, ended up with their PTSD. But we can start restoring their skull to their earlier alignment patterns, and then, except where there's scarring in their brain, which in these men's cases I don't think there were, then we can restore their earlier function. And then as we restore the original head alignment, we also improve the spine and pelvis alignment, so then they start being able to do sports and things as they had done when they were younger as well. So, PTSD, the treatment of choice is NCR. Thank you.